What is up, guys? Welcome to my channel, Hairlicious. If you guys are new to this channel, please make sure to subscribe so that you guys are updated on hair loss treatments, hair transplant tips, and current hair loss treatments in the pipelines, along with microneedling with derma rolling. So as you guys can tell in this video, my hair is down, and normally I don't really put my hair down, but I just got home, took a shower, and I just want to show you guys how my hair looks like without gel. Now, the thing is, a lot of people that end up getting hair transplants, they don't really put their hair down just because they don't have enough density. And this is one of the reasons why I'm getting my second hair transplant, because you guys can kind of see through the existing hairs here because there's not that much of density. And so my number one goal is to increase the density. But I just thought that I would share this with you guys in case you guys were wondering. Okay, so there has been a lot of requests to cover the topic of PRP and Acell therapy. I actually posted a discussion yesterday, and there's some people that wanted me to talk about these two topics. And so in today's video, I'm going to be mainly focusing on PRP and Acell. And I'm pretty sure most of you guys are aware, but PRP, also known as platelet-rich plasma, is derived from a person's own blood platelets to enhance hair growth and improve the recovery and results before and after a hair transplant. Now, PRP helps attract and they stimulate the stem cell activity to improve the wound healing and naturally rejuvenates the skin and also the hair follicles. It also contains stem cells, which have been used in a lot of the medical specialties, including sport medicine, dermatology, neurosurgery. It's mainly used for tissue regeneration and repair to help patients avoid risky interventions. So the way that PRP is done is usually they obtain some blood samples from a patient's arm, usually about 100 to 120 cc's, and then it's run into a centrifuge to separate the platelets and plasma serum. These are the ones that actually contain the growth factors from the other components like red and white blood cells, which are actually pro-inflammatory cells, meaning that they are going to be negative towards healing. Now, these platelets and serums also release powerful molecules which have profound biologic effects on hair follicles. These growth factors are then injected into the scalp where miniaturization has occurred. PRP used to stimulate hair growth is unfortunately not permanent, and it's going to require you to get treatments every 6 to 12 months. Or even sooner. There's some people that do end up getting treatments every 3 to 4 months. But the good thing is that there are scientific studies that determine the efficacy of PRP in males suffering from androgenetic alopecia. One of the studies found that significant reduction in hair loss was observed between the first and fourth injection, and hair count increased from 71 hair follicular units to 93 hair follicular units. So that's about gaining an average of about 22 follicular units per centimeter squared. We also had another study that showed that PRP resulted in a mean increase of about 33.6 hairs in the target area, and a mean increase in total hair density of 45.9 hairs per centimeter squared compared with baseline values, which clearly highlights the positive effects of PRP injections on male pattern baldness without any major side effects. So I will go ahead and link the two studies in the description box below for those who are interested in reading it. Now, there's also something called Acell, which has been used in conjunction with PRP by many hair transplant doctors and hair loss clinics. Acell is an animal, it's a pig-derived extracellular matrix tissue regenerating technology that helps stimulate stem cells and enhance the wound healing process. Specifically, Acell works at the cellular level by recruiting adult stem cells and increasing blood supply to the site of the wound to repair and remodel damaged tissue. What happens is during the healing process, Acell converts these adult stem cells back to their active form as progenitor cells. They also facilitate healing by leaving new native tissue where scar tissue would normally form. And stem cells recruit other cell types to the area to bring tissue regeneration. Once PRP and Acell are injected into the scalp, it regenerates the dormant follicular tissue and increases hair growth and quality. As a result, it has actually been very beneficial when used on the donor and also the recipient sites after having a hair transplant. And some doctors also use it as a holding solution for grafts before they are transplanted into the recipient zones to promote healing and also to improve graft survival. So here is an image of a strip donor scar repair provided by a manufacturer of Acell. This is prior to Acell application and then 5 months post application. You guys can clearly see that the scar has definitely improved appearance. So the benefits of PRP and Acell injection therapy include slowing down the hair loss process while providing providing thicker density by strengthening miniaturized areas and also stimulating hair growth. There's also been a lot of people who have had hair transplants and had PRP and Acell, and they've actually seen faster hair growth results than patients who actually did not get any PRP injections done. And as far as pricing, Acell and PRP can be pretty expensive depending where you get it. It can run anywhere from $1,000 to $2,000 per session, and it can vary depending on the size of the area that's being treated. So by no means is this a cheap method, at least not in the US. And I find that this is kind of stupid because there's hair transplant clinics in India and other places like in Turkey that charge only anywhere from like $50 to $100 for a procedure. And it's such a simple procedure. It uses your own blood, and I think it's a ripoff in the US no matter how effective that they claim that it is. Okay, so let's go ahead and take a look at some before and after photos of users who have actually had PRP and Acell treatment done. So this one here is a 26-year-old male who experienced frontal and occipital hair loss, and after results from using Acell with PRP at 16 months. We can clearly see that the crown is definitely filled up. Okay, so this next guy is a 29-year-old male who received Acell and PRP, and the results that you guys see are at 6 months, which is pretty spectacular. All right, next one, 52-year-old male who received Acell and PRP with 1 year before and after results, which showed increased density in the mid-scalp region and also the frontal hairline as well. This next person is a 64-year-old male who had 1 PRP and Acell treatment, and this is 1 year results with increased terminal hairs, and his part line also has gotten more narrow, which means that density increased and also hair growth also has increased. This is a 21-year-old male who received a treatment of PRP with Acell, and after 1 year, his hairline, you guys can obviously see that it's thickened, as well as his mid-scalp. This is a guy who is 61 years old who had just 1 treatment of PRP with Acell, and just after 6 months, he saw increased density on the crown with thickened hair. He returned actually 3 years later, and substantial hair was still remaining from the original PRP results. The other thing was that he was also taking dutasteride for several years prior, so it could have been that PRP and Acell helped stimulate hair growth, and dutasteride actually helped him maintain his gains that he got. Here's another one. It's a before and after 1 year of Acell and PRP treatment. Great results with increased density all throughout his mid-scalp and crown area. Guys, the results are there. PRP with Acell not only helps speed up and accelerate hair growth after a hair transplant, but it can also help improve hair density and thickness, and it can also improve scars, especially if you guys ended up getting an FUT, the linear scar on the back of your scalp. But PRP and Acell is best used when used in conjunction with other hair loss medications such as finasteride or dutasteride, and also minoxidil to promote maximum hair growth potential. And as far as side effects, some people experience minimal pain, pinpoint bleeding, redness on the area that was treated. Some people commented on feeling a tightness in the scalp after the injections. Some people had headaches, but there was nothing major in terms of side effects. And the other good thing that I wanted to let you guys know is that Acell, since it's technically derived from tissues of pig bladders, it's actually stripped of cells and muscle tissues to prevent any allergic reactions in users. So in conclusion, PRP and Acell is definitely worth a try, although it might be a bit pricey, but some clinics do offer for free of charge after a hair transplant, since they know that it actually aids in faster recovery and faster hair growth time. I personally would do it if it was a lot cheaper, since paying $1,000 to $2,000 a session, it's just outrageous. And I'd rather stick with the big 3, minoxidil, finasteride, Nizoral, and just maintain the hair that I have that way. Now, I've never actually had PRP, so I can't really comment on it except from the research that I've done and from looking at the results of other people who actually had PRP and Acell done. So for those who've actually had PRP and Acell done, let me know how your results came out to be. I'm actually curious to find out if it really was effective or not. So drop me some comments in the comment section below. And last but not least, if you guys are looking for a proven method to regrow hair, look into microneedling and derma. We already know that microneedling helps stimulate hair growth by increasing collagen production. It also increases stem cells that lead to hair growth. And it also increases the blood flow into our scalps, allowing the hair follicles to get the nutrients that they need to thrive. I've written a detailed blog on this on my website at HAIRLICIOUSLY.com. Make sure to visit my website and take a look. So thanks again, guys. If you guys have any questions, let me know, and I will talk to you guys next time. Take care.